Recently, the World Health Organization declared coronavirus has become a pandemic all over the world. And as a corporate organization, it behoves on us on this station to sensitize our people on the need to protect themselves. What are the do's and don'ts of coronavirus? How do we protect ourselves from this pandemic? And that will be our topic of discussion on Your Image today, coronavirus and PR approach to prevent COVID-19. And I'm sure it's going to be very interesting, it's going to be very, very enlightening, and it's going to be very, very educating because it is an issue that concerns all of us, especially in Nigeria and in Ogun State particularly. And on the show today, I have people who know their onions in their various professions that will join us to talk to our viewers today. On my far right, I have a media personality, is a broadcaster, and a journalist of note. Join me as I welcome Mr. Emmanuel Oke to Your Image. Mr. Oke, you're welcome to Your Image.
Thank you very much.
I'm glad to have you for the second time on our show.
Yes.
Or fourth time, so to speak.
Okay, this will be the third, technically.
Time,
yes.
You are welcome to
Thank you.
this program. I also have on my right-hand side, very close by, is a pastor, is a PhD student, and he's also a medical laboratory scientist. Join me as I welcome Pastor Felix Akintaju. He's a medical laboratory scientist and assistant director at the services of the Ogun State Health Management Board. You are most welcome, sir.
Thank you very much. Dears, thank you for watching Ogun State Hospitals Management Board.
Okay, thank you very much. I also have on my immediate left-hand side and the only Amazon on the show today. She is a consultant public health management from the Federal Medical Center, Abeokuta. She's no other person than Dr. Mojirola Martina Fashiku. You are most welcome.
Thank you very much. I'm glad to be here.
As I said earlier, that COVID-19 is a pandemic as declared by the World Health Organization. And as we speak to you today, Nigeria has 51 confirmed cases, 1 dead, and by the grace of God, 6 patients will be discharged in Lagos very soon. And this is a very good news for all of us. But it is also important for us to sensitize our people on this show today. And let me start from my immediate left-hand side, Dr. Fashiku. Let me start from you. Coronavirus has become a pandemic. In fact, it has become a household name today. Even our children at home know what it's all about. First and foremost, as a medical practitioner, can you please tell our people what we mean by coronavirus? Because even some of us who are lettered, we just mentioned coronavirus or COVID-19 as the case may be. What is the virus all about?
Thank you very much. The virus is an infection. The disease, COVID-19 disease, is caused by the coronavirus, which is one of the viruses. This one is known as SARS-CoV-2. Let me not bore you with the whole thing, but the virus is coronavirus. It's caused as a result of infection transmitted from one person to the other. Initially, it was thought to be transmitted from animals to man.
Okay,
in fact,
human generally.
Yes,
okay.
To human generally. But now, you know, investigation is ongoing to actually know, because now it was the species, looks like the species of virus that occurs in bats.
Okay.
But the commonest source of transmission is from human to human right now. That's the one we have now. So now the virus is spread via droplets when someone coughs or sneezes,
okay,
or contact. You know, the droplets can either fall on surfaces, and when you touch the surfaces, then you can be infected. One thing is that we should actually prevent ourselves from touching our mouths,
okay,
nose,
okay,
and eyes.
Okay.
This is difficult, but we should try as much as possible not to touch our eyes, nose, and mouth, because we can contract the disease via these means.
Okay.
And another thing to take note of is that this virus, it doesn't get transmitted via the skin.
Okay.
If the skin is not broken, definitely it can be transmitted. So the mucous membrane, like I mentioned, the eyes, the nose, and the mouth. And what can we do to prevent this?
Before I go there, I'm to ask a question, but I'll come back to you immediately after this question. I want to ask Pastor Akintajo this question, because I was going to ask you, we have had Ebola in this country, you have had Lassa fever in this country. So I'm coming back to ask you to now tell us differences among all these. So let me go back to Pastor Akintajo now. She mentioned certain things there, these viruses. As a medical laboratory scientist, what are those things we should look at that will now say, okay, this person has contacted this virus? Can I come to your office or to come and carry out the test, or how do I know?
Thank you very much, sir. SARS-CoV-2, the full meaning is severe acute respiratory syndrome coronavirus 2. That's the name of the virus. The name of the disease is COVID-19.
Okay.
The diagnosis or the symptoms, let me start with the symptoms. The prevailing symptoms that will make you know that somebody is down with COVID-19, that is the disease now.
Okay.
When an individual gets himself infected with this SARS-CoV-2 virus, the virus goes into the body,
okay,
and has a window period within which the individual, the virus will develop, multiply, and depending on the immunity of the individual, and depending on the load of viral infection, will determine the length of the window period. From the statistic we have presently, between 1 and 14 days. That's why you see they keep saying if somebody goes for has exposure to this virus, he will self-isolate himself, okay, or quarantine himself until symptoms begin to come. Because quarantining is when the symptoms begin, before the symptoms comes. The moment you get tested positive, then you are talking of isolation now. That's tested patient. So in this present, what we do see now, we have fever. The individual will have fever, though not all cases, because researches are going on. And from the latest paper we are reading now, they are even saying that fever is not even consistent. But cough, sneezing is also part of the symptom. They are still not consistent. So what you can see that most times it is the cough, it is the sneezing, it is the fever, it is the dyspnea, which is difficulty in breathing, that are the common symptoms that we see to make us. The only thing I want to say is that the level of infection does not start at the time that the person has started manifesting symptoms. No, the moment you get infected and you develop enough virus, the individual is capable of transmitting this virus. So even at day 3, day 4, day 5, we call it asymptomatic patient. A patient that is infected but has no symptoms, that will point to the fact that he is having this infection. So in that period, he has the potential to transmit this infection. And that is the challenge I'm worried about now. Because when we are talking of contact tracing, you are talking of contact tracing when somebody who is infected can remember that he had contact with somebody who is tested positive. But at the stage that the fellow has not gone for testing, because the way we are doing it in Nigeria presently, and I'm praying that God will help us and God will help our government so that we'll lay more emphasis on testing. We wait for symptoms before we test, or has somebody had contact with somebody who has been tested positive before we test? Ideally, it should not be, because of the 3 modes of transmission of this particular virus. We have the droplet transmission, we have the contact transmission, and we have the third one, which is the aerosol transmission. So looking at these 3 categories of transmission, test kits should be freely available so that we easily know our status, and we know those that are yet to begin to develop symptoms that we need to isolate, even when they are not yet developing symptoms. So we know where the real mass of this infection, to know whether it is general lockdown that will be better for us.
Okay, I'm still coming back to that. And before I go to Mr. Emmanuel, okay, please let me go back to Dr. Fashiku. I was to ask you, it seems this coronavirus of a thing, it looks or sounds more deadly, or deadlier than Ebola. We have had Ebola in this country, and the noise was not as much as this. We have had Lassa fever in this country. But this one, even a common man in Nigeria, even an illiterate, knows about this. So can you please tell us the difference among the three? Because this looks more pandemic, more, closer to the people. Yes.
Okay, thank you. When you say something is pandemic, that means it occurs all over the world. Different countries, different continents are being affected. So Ebola is not everywhere that you see Ebola. And in fact, Ebola is more deadly than COVID-19 because the case fatality is not as much as the one of Ebola for the COVID-19. Yes. The COVID-19 initially was said to be case fatality of 2%, some are saying 4%. So Ebola, sometimes it can be as high as 20-something%. So it is better not to even, we can't even compare it. Like Lassa fever too is not a pandemic. Okay. It's not. Because this one is occurring all over. That's why it is like this. And it's easily transmitted, and that's why it was named FAID. Okay. That means Public Health Emergency of International Concern. That means that everyone is affected. It can affect international trade. It is sudden, and it can affect international travel. That's why you see all international airports being shut down at the moment. So this is the reason why it is different from the others. And you have different modes of transmission too for that. Rodents is implicated in Lassa fever, then Ebola, the bats is implicated, and the transmission for this, they are quite different. But we can say that this particular COVID-19 to be transmitted from one person to the other, the rate of transmission is so high, and it has to do with our hygiene. It has to do with our hand hygiene, because once you touch and you touch the surface,
the parts of your body.
Yes, especially the mouth, the eye, and the nose that I mentioned earlier. Okay. So it's important for us to actually take this seriously, and because it's a pandemic, like I said.
Okay, let me go back to Mr. Emmanuel, as a media personality, as a journalist. Will you say that the enlightenment, public enlightenment of this is enough? Going through streets, from street to street, one hardly could find a poster sensitizing people on the danger of this. Going to the doorstep, don't you think that the National Orientation Agency, as a government agency, has a lot of job to do in this area?
I would break it down into what has been done and what should be done, or what should be added to consolidate the things that have been done. All right. Let us trace it back to when the coronavirus first became a thing initially. That was at the latter end and the early part of 2020. Okay.
From 2019?
Yes, 2019. Chinese authorities, there are doctors who tried to warn people. But because when there is a crisis, information sharing, and if it's not controlled, can lead to two things. It either leads to panic or create an awareness. An awareness can help prevention. So I believe then the Chinese government was trying to avoid a panic if the information is not well managed. But because of what we have now, it has grown into a pandemic. It means every means must be deployed to make sure that awareness spreads. As it is, many stations are doing a lot. Many media houses, many practitioners are trying there, even the National Orientation Agency. But it will be unfair to blame only the National Orientation Agency.
Okay, why?
That is because they are not the only one responsible for information. I am responsible, you are responsible, we are all responsible. The Ministry of Information, the Ministries of Information, they are there. Humans are there, celebrities are there. All of us should be responsible for this. So, yes, it should not just be something we will dump at the footstep of the National Orientation Agency alone. And as it is, if you look at some clear things, you would see that we've not done enough in making information. People know there is coronavirus, but people don't know what coronavirus is in itself. People don't know how to prevent it. People get wrong information. I was listening to a station yesterday in Abeokuta here, and somebody who feels he was trying to enlighten, one of the big names, said coronavirus called it a virus and said it's a bacteria. That is common sense. So the thing is, people know what coronavirus is, but there is wrong information being shared on how to manage coronavirus. On the prevention, we hear a lot: drink this, drink hot water, drink alcohol. All of these things would remain nonsense, absolute nonsense. So that is why people, all of us, should be responsible for not just getting across information, but the right information on coronavirus.
Okay, you're watching Your Image on this station, and what is our subject of discussion today is coronavirus and PR approach to prevent COVID-19. I told you earlier that it's part of our social responsibility on this station, and my guests are still very much around with us. Let me go to Pastor Akintaju, now as a pastor. In recent time, a few days back, government placed a ban on religious activities, social gathering, irrespective of maybe party or anything, but religious organizations, to be specific, irrespective of religion now. But some felt recalcitrant. They still went ahead to convert their people in the name of religion. Don't you see this as an aberration? And don't you see it as a way of exposing our people to this virus in the name of religion?
Thank you very much. Somebody said when the purpose of a thing is unknown, the abuse of that thing is inevitable. The government came up with that law because of the wealth of knowledge at their disposal. And they felt that that's the best thing that should be done at that point. Corroborating what my brother has said about information, I realize that many of our people, when they have inadequate knowledge, they misinterpret whatever comes from the side of the government. As a citizen of a nation, we are number one supposed to respect the rule of the law and whatever the government says. Even the Bible commands us to pray for those in authorities. And so if anybody, I want to give it to individual differences. I want to give to individual differences. Because looking at it critically, what the government came up with, lockdown, social distancing, these are the things the government feels we can do now to reduce the transmission of this infection where we have crowd. And now, if that is the case, and some people decided on their own to be recalcitrant to that kind of law, if I have my way, such people should be more enlightened. Okay. I would take it to be ignorance on the part of them, because it depends on, there's no way you will violate the law of the land that you will not be charged as a violator. One of our erudite scholar, Professor Soyinka, said that those people, it counts them to have been victim of contravenance of common sense. Contravenance of common sense, because ordinarily, to me, adequate knowledge will behoove every one of us to know that when the government is saying this, we at the other side will not have a detailed information at the disposal of the government for coming up with that, and they have responsibility to protect us and preserve us. Because looking at it, if I will bring in the idea, or maybe it's because somebody is looking at the fact that it is faith, the blood of Jesus, the name of Jesus, yes, it works.
And the name of Allah.
Yeah, the name of Allah, irrespective of religion.
Yes.
That whatever one believes in, it works. It's true. If it does not work, nobody will be serving any God. It does work. But we are talking of obedience now. Obedience is synonymous to holiness. So even sometimes you have a good point. If the people in authority are saying this is what we feel we should do, let us, the best way to show to others is to comply with that law. Comply with that law, and then the way it is now, I want to believe that with much awareness, with increase, because like our brother said, I still want to believe that we've not done enough on the area of awareness. I was talking with my MD a few days ago, and she told me her experience. She went to the market to buy pepper, and the woman was not telling her, the woman that was selling, they are just punishing us. They are just, all of them have millions in their account. See now, the malam that bring pepper from the north, they don't know that bring pepper because of coronavirus. They said, well, she sit down at home. She said she has to go out of her way to educate the woman. Please, nobody will do that. It's because you don't understand what we are talking about. So the awareness really needs to be stepped up.
Okay, before I go to Dr. Fashiku, meaning that you are in support of government dislodging religious organizations who still try to gather people for religious...
Perfectly, sir.
Okay, thank you. Now you can join the conversation via the number being displayed on your television set. Tell us where you're calling from, and please ask my guest your questions. The number is being displayed on the television set. Now, Dr. Fashiku, so much has been said as an antidote for this virus. Some people will say take chloroquine. Some will say take dongoyaro, put it in water, cook it, drink it like herb, and the rest of them. Can you tell our people whether this is right or not, or what should be the preventive measures to take?
Okay. First and foremost, I would like to correct that in terms of taking dongoyaro, taking garlic. Some people would say take warm water, bathe with warm water, put salt in. All these things, they are very dangerous in terms of garlic is good, fine.
Naturally.
But we have not found any evidence to support the fact that it is used to treat coronavirus. Chloroquine, a lot of people are taking chloroquine now. Please let us be careful. Clinical trials are still ongoing. There's no licensed treatment for now for the treatment of coronavirus. So it is better, once you're not feeling fine, please contact your healthcare provider. And please, for those that are coughing, for those that are sneezing, for those that have fever, difficulty breathing, please contact your healthcare provider. Another thing is that those that traveled and are back, please quarantine yourself.
In what sense?
What I mean, because people call it self-isolate. Yeah. They don't have the symptoms yet. Okay. But they are just from places that have high number of cases. So like UK, like Spain, like Germany. So once you are back, you need to quarantine yourself. That means you need to keep yourself indoors for maximum of 14 days. Okay. That's, the incubation period for the disease is between, some say 1, 2, and 14 days. Okay. So after 14 days, you don't develop such signs and symptoms, then it's not likely for you to have the disease. Okay. Then another thing I would quickly join, those that had contacts also with those that are confirmed cases should also quarantine themselves. Is those that have the disease that are isolated. Those are the ones that should do self-isolation. Fine. The people that quarantine themselves, once they develop signs and symptoms of the disease, then they should contact their healthcare providers. They shouldn't go about...
I think we have a call from Ajebo, from Iroko, from Ajebo. Let's hear our caller. Hello?
Yeah, I want to ask a question.
Okay, please go ahead. Good evening. You're welcome to the program.
Yeah, the question is, assuming one has the coronavirus disease,
yes,
and is cured, after being cured, is there any chance of double exposure or second infection? Or that is also the then the second question, after the person is cured, are there going to be any permanent scar or any permanent illness that the person has to be managing for the rest of his life?
Okay, I think you had the question that those who with confirmed cases, after they might have been treated, are they going to be exposed to certain drugs to the rest of their lives? Have they been cured permanently, or they have something to still be taken?
Okay, for those that have been treated, usually you will hear that a test is being carried out again to find out if they are negative of the disease. Yes. So once you are free from the disease, you don't have to take a particular drug again. But some are still saying, like I said earlier, clinical trials is still ongoing. Some will say that this virus can still be excreted in the feces and all that. Based on clinical trials, please, let us be careful with information we get here and there. The real information that you can be provided with can be gotten from WHO sites and NCDC sites. all other ones like WhatsApp, different clinical trials, you hear a lot of things, chloroquine, azithromycin, other things. Please let us be careful.
Okay, let me now go to Mr. Emmanuel. Okay, as a journalist, government has placed ban on certain things. I said earlier, religious gathering and the rest of them. Even public transport. He said in Ogun State, public transporters, the taxi cabs should not take more than 3 people.
More than 3.
Okada rider ordinarily shouldn't take more than one. But they have stopped, at least restricted them to 1, tricycle 2, and people still violate this. What should be the role of the media in enlightening these people? Many still lay claim to ignorance. What is the media? What role are the media playing to ensure that people at the grassroots are aware of these government restrictions?
There's one beautiful thing about this coronavirus,
okay,
and that is the things we should have done before that we failed to do. The coronavirus is now forcing us to do. Naturally, social distancing should have been a thing we should have been practicing before now.
Okay.
Coronavirus is now forcing us. Information sharing is something we should have been doing. Awareness, health awareness, health communication is something we should have been doing before now.
Okay.
But the coronavirus is now forcing us to do it. Because if you wouldn't do it yourself, then something will force you to do it. So back to your question, there are some things that should be done. First off, I personally do not agree with certain things and certain ways with which matters have been handled.
Okay.
For example, from the top, it took agitations from different quarters to have somebody, the commander-in-chief, address the whole nation on this. If the president or the person in charge addresses, it puts at ease the mind of the people. Besides, some of the things that should be done too is that if you look around the streets, because of the way we have been wired as humans, our brains are magnetic to what we see. And it is better when we have visuals, not just audio. Let's go back to PSAs. Recall the days of Ino Morada. Let us go back to this. Our wrong PSAs. Let us also quickly, information van of local governments. Let them do all these things.
I know we have so much to talk about on this issue, and we have been receiving calls, but because of bad signals, I'm sure we're going to continue with this next week, God willing. We have to wrap it up on this edition, this week, God willing. And I want to say a very big thank you to my guest on the show today. Let me thank Dr. Mojirola Martina Fashiku from Federal Medical Center at Abeokuta. Thank you very much for being part of this show. And I hope when we invite you next time, we'll be here. Definitely we're going to continue next week. Let me thank Pastor Felix Akintaju. God willing, he's going to get his PhD very soon. Thank you very much. And of course, Mr. Emmanuel, okay, thank you for being part of us. See you next week, God willing, on another edition. We're going to continue with this by the grace of God. Until we meet next week, let's take care of ourselves and let's be angelic. Thank you. See you next week.